Good afternoon and welcome to the first EBMT webinar focused on the psychological impact of COVID-19 pandemic on nurses. First of all, we would like to thank EBMT Nurses Group, especially Michelle Kenyon and John Murray, for giving us the opportunity to share some of the Spanish nurses' experiences. And thank you for all your expert advice that I'm sure will help nurses to cope better with the difficult situation they are currently dealing with. My name is Isabel Salcedo, and I'm a research nurse working at Puerta del Hierro Hospital in Madrid. I will be giving a briefing on the impact of COVID-19 in Madrid, Spain, and how hematological units have responded to it. Then my colleague Julia Ruíz, who is a BMT nurse quality manager, transplant coordinator, and a member of the Global Educational Committee member. She works in a pediatric hospital in Madrid, will share with you some experiences from hematology nurses during the pandemic, based on its psychological impact. Finally, Troy Chase, clinical psychologist working at Hammersmith Hospital, will give us some advice on how to cope emotionally with the situation. None of us have any conflicts of interest to declare. The learning objectives for this webinar are to share nurses' personal and professional experience of the impact of COVID-19 pandemic in a highly affected city like Madrid from the point of view of nurse managers, nurses who stayed at hematology units, and also nurses who were relocated from hematology to COVID units, and also to provide nurses with psychological strategies to cope with the current situation of working at the trenches. As you probably all already know, Spain is one of the most affected countries by COVID-19. As yesterday, 6th of May, Spain has confirmed over 200,000 cases and over 25,000 patients have died of COVID-19. Data provided by the European Disease Control Center shows how Spain is the European country with the highest incidence of SARS-CoV-2 cases, with 469 per 100,000 people. It is also the second highest European country after Belgium regarding mortality rate, with nearly 55 cases per 100,000 population. The two most affected regions in Spain are Catalonia, mainly Barcelona and its surrounding, and especially Madrid. Madrid, the capital of Spain and its region, have a population of 6.5 million people. Over 60,000 cases of COVID-19 have been already confirmed. The state of alarm with the population quarantine was declared on the 14th of March. After 7 weeks, so as yesterday, 6th of May, Madrid has registered over 8,500 deaths in its hospitals, as well as 4,500 more deaths in nursing homes. At the moment, we still have around 600 patients in intensive care units, as well as 2,500 inpatients in the hospitals. In Madrid, there are around 30 public hospitals and 15 private hospitals. And in all these hospitals, there have been cases of COVID-19. So how did hematology units handle the outbreak? In general, as in any other countries, there has been a reduction of inpatient on hematological wards. Accordingly, both medical and nursing staff has also decreased. Senior hematology nurses were on the wards, while many junior healthcare professionals, both nurses and doctors, were relocated to COVID wards. We have had a high rate of nurses getting infected by SARS-CoV-2, with very few hematological patients getting infected, which points out towards a community-acquired infection, as well as nurses getting infected in the staff rooms or nurses' stations or coffee breaks. All patients were tested once they get admitted on the ward. If the result was positive, the patient was transferred to a COVID unit in order to reduce the risk of infection to other hematological patients. As I said before, we have had a minimum rate of patients getting infected on the wards. There was also a reduction of family carers on the wards. Visits were banned, and in some cases, one family carer was allowed to stay in the room with the patient. This situation was decided case by case by the medical and nursing teams. Once this was decided, neither patients nor carers were allowed to leave their rooms unless there was obviously an emergency during the whole admission. Lastly, dealing with supplies was probably the most stressful task on the wards, especially for nurse managers. In the beginning, there was a shortage of personal protection equipment and masks at most hospitals, as well as there was some uncertainty on the supply stock. It was difficult to tell how much supplies could be obtained and when they would arrive. There were also moments of unclear information within the hospital. Data and procedures to follow by the staff were not always clear. So how do managers handle it?
Okay, thank you, Isabel. In this part, I will share the feedback from nurses about, as we have said, the experiences and feelings in this difficult situation from 4 hospitals in Madrid. We asked, as we have seen, nurse managers, nurses from hematology and transplant units, nurses from these units that were relocated to COVID units, and lockdown nurses due to positive testing or vulnerable nurses at risk for any cause. So how did they handle this situation? Nurse managers. With the staff, junior nurses were sent to COVID wards, and nurse managers had to handle also other wards, COVID wards mostly. So senior nurses covered their tasks. Also, they had to handle shortage of staff due to the positive tests for COVID. Their concerns were about being able to keep up 100% at work, to protect patients. Therefore, there was no admission in the ward without testing patients, and they checked staff for possible symptoms. Implementing correct workflows to avoid transmission. Taking care of staff, protecting them, mostly staff with some comorbidity. Helping staff with stressful situations. Ensuring stock of supplies of personal protective equipment. So they named responsibles for the control of these supplies to try to avoid the shortage. At home, concern was about protecting their families, so many decided self-isolation. And how did nurse managers feel? They felt fear, having sometimes things out of control, and anger due to this situation. Gratitude toward nurses' efforts and availability and kindness. On the other hand, also sadness toward some selfish attitudes. And stressful situations with other professionals, mostly when they had to deal with personal protective equipment, rather if they had to use them or not for some tasks. They had emotional distress, feeling helplessness when patients died without their family. Not being able to spend more time with patients, mostly elder patients that were more vulnerable. Knowing that some nurses continued working even though among their families there had been deaths. Long shifts without being able to give days off, affecting them physically and emotionally. Feeling lonely when self-isolation, although it is important for them to know that their family was safe and well. Worries about young and junior staff feeling that they couldn't support them completely, thinking of the consequences that this may have in their professional career. They usually manage all these anxiety and distress, sharing worries with their colleagues, with other nurses, and other nurse managers. What about the nurses that were relocated to COVID units? Their feelings before relocation were fear of something unknown and getting infected. They decide to protect their families also by self-isolation. Anxiety, This is not always easy to recognize and also to accept. But there are also positive feelings, like the feeling of knowing that they are going to be helpful. When they are already in the COVID units, they found a great demand from the patients, more than what is the usual demand. They feel exhausted because physically shifts were long and hard using the personal protective equipment. Sometimes frustration also. They claimed for more personal protective equipment to be able to attend patients when they required it, to support them emotionally, to enable communication with their families. And one of the biggest emotional challenge was to empathize with patients' feelings, the fear of dying, and especially the fear of dying alone without their loved ones. And there are also positive feelings. As positive, they describe as positive aspects social recognition, personal fulfillment, strength, fellowship, feeling that they are being looked after by other colleagues, and also a deep gratitude coming from the patients more than ever. Some strategies of the hospitals is psychological support delivered by psychiatric services. They go and talk with the professionals that need this support when shifts ended. There are also psychological phone services to attend the demands of the professionals supported by the Ministry of Health. They also use some individual strategies to cope, such as having a shower, thinking that a new day is beginning on the next day, having family as a refuge, avoiding watching news, and doing other activities such as crafts, cooking. Which is the impact on nurses who stayed at the hematology units. Staying at the unit makes them feel safer because it's a free COVID unit. There is more restrictive isolation for patients, family, and for them, and sometimes it's hard to cope with this. But they know they are doing the best for the patients. Therefore, care plans have changed. They have changed to protect patients with more restrictive isolation, as I said before, with no permission for visits or families staying with the patient. So they have to support patients in all these aspects because they feel sad, worried, and suffer also anxiety. They had to understand about the consequences of the delays of transplant for these patients that they know well, being concerned and also giving support about their fears. And also taking care of the families, helping them to cope with the fear of COVID, providing all the possible information that could help them. Nurses, they here consider that at the moment they don't need psychological support because they usually handle difficult situations in these units. And our last scenario is about lockdown nurses. What happens to nurses when they have to self isolate due to positive testing, or vulnerable nurses with any comorbidity? They feel guilty due to the possibility of having transmitted infection to patients and or family members. Anxiety for adding pressure to other colleagues, having to work more shifts. Helplessness for not being in the front line when where they think they should have been. And if they are working from home, sometimes they have the feelings of not contributing enough, especially if they are asymptomatic. But mainly, they feel gratitude towards their colleagues. We would like to thank all nurses that are doing their very best in any of the healthcare centers around the world, primary healthcare, hospitals, home care, and mostly today, nurses from these four hospitals of Madrid, Hospital Puerta de Hierro, Hospital 12 de Octubre, Hospital Gregorio Marañón, Hospital Infantil, Niño Jesús, that have made the effort to share with us experiences and feelings. And we wish you all to stay safe. Thank you, and now we'll hand over to Troy.
Thank you very much, Julia and Isabel, for talking us through the impact that COVID-19 pandemic is having on nurses across Europe and particularly highlighting the experiences of those in your area in Spain. Thank you. I will now talk you through some of the tips that I hope you will find helpful for coping with the pandemic. But before I do that, I think it's going to be very important that we are mindful of a number of considerations. Isabel and Julia have talked about a number of emotions that can be experienced at this time, including frustration, fear, gratitude. They've also highlighted that a number of positive emotions may be experienced, including feeling helpful, a sense of strength. Um, I think it's also useful for us, though, to know that a number of different reactions and feelings are going to be experienced by all of us. It's not one size fits all. All of these experiences are normal. Remember that this is an extremely challenging situation. This is also unprecedented for particularly for our generation. Few of us have experienced anything like this before. And so it's very understandable, therefore, that we are having the emotional reactions that we are, because we largely do not know how to cope with the various challenges that are arising. When we listen to the experiences of others, I think it's important for us to note that different emotions will be experienced at different stages of the pandemic. For some of us, we will experience sadness at the start, but maybe others will experience sadness at later stages. Anxiety may be felt initially, or anxiety may be felt later down. And so I think it's very important that we remember that it's not abnormal if we're not feeling any of these emotions at all, or if we're not feeling them at the point at which other people around us are feeling them. It's also important for us to know that you may feel as though you're coping one day, and another day you may not feel as though you're coping, and this is completely normal. Everyone is different, and everyone will experience the emotions at different times. Although I will talk you through some strategies that I hope will be helpful, I hope that you can remember as well that you are a human being who has made it this far in your life because you've used a number of strategies to help you to cope with life and the challenges that it brings. So at first, remember that there are strategies that you have used in the past and they might be helpful for you to use now. When using strategies, I encourage you to be very mindful of your expectations. When you use a strategy, it may not get rid of the feelings completely. It might just help to reduce the intensity of what is being felt, and that is as much as you may be able to hope for at this time. So it's important that you not beat yourself up if the strategy is not working as well as you thought it should, or as well as you thought you hoped it would. So let's look therefore now at some tips for nurse managers. I think it's important for you to provide good quality, accurate information to those around you. Make sure that the information is open and honest and frank so that people believe you, so that they know what is being expected of them now, but also it might be useful for you to provide information on what may be expected of them ahead. So the time that's coming. It might therefore be useful when communicating information to have regular feedback mechanisms so that the messages can be received quickly and also that you can provide messages to others. So maybe you might think about times of the day where you have a handover in the shifts, where you can have discussions around how people are doing and they can give you some feedback as well as you giving them feedback. As a manager, it's very important that you give your staff permission to step back and ensure that they take rest and breaks. They may feel guilty to do this independently of this permission, and so I encourage you to give them permission to do so. Please be very mindful of those who may need more support. Remember that, as I said when I started to talk, people react very differently, and you may have others who in your staff might be more vulnerable to the effects of everything that's happening now, And that may be because they have a number of other things happening at home, or they may have had other difficulties before, such as anxiety or depression, that means that it becomes more difficult for them to cope now. So you might want to have a think about how best you can keep your eye on those that you want to monitor. Try to be flexible. Do not think that one approach is going to work well with all members of your staff. Remember that people have different needs. It might be useful for you to consider a buddy system where you partner inexperienced workers with those who are more experienced. The person who is least experienced may also get an opportunity to learn how to do things from the one who's more experienced, but this may also be a way for you to monitor who is finding it particularly difficult. And very encouragingly, I encourage you to talk to staff and encourage them to use support and peer support. Remember that if the social support and peer support is set up within your environment, this may be helpful and may actually stop the need for people to want more formal ways of coping, such as having psychological therapy. It's also important for you as a manager to be kind to yourself. You do not need to have all of the solutions. Remember, these are unprecedented times for our generation. And so you take the pressure off yourself, but sit down and consider possible solutions with others. And this might be others in your team, but this might also be others outside of your team. When considering solutions, include your in-house psychologists. Discuss with them what they might be able to offer. But also, they may be able to guide you about what measures you can put into place to support your team. And also, know what supports may be available and be sure to help guide the staff to the supports that are available. So consider maybe putting notices in staff rooms, for instance, sending out emails, letting others know that there are a number of websites, forums for discussions, and helplines that may be available to support them. As a manager, you are a manager second, but you are human first. You will therefore experience the reactions that we talked about. You may also experience feelings of stress, guilt, sadness. Because you have these experiences does not mean that you're not up for the job. Remind yourself of this. These are uncertain times. Practicing, tolerating, and managing uncertainty for yourself and your staff is going to be very important. I'd like to now go through some tips for nurses as well. Hopefully your manager will be giving you permission to take regular breaks during your shifts. I also encourage you to take them up on that. Please do not feel that if you need a break, that shows any weakness on your part. This is not the case. We all need breaks. And when you're at work and when you're at home, I encourage you to eat well, drink well, and particularly consider sleeping and try as best as you can to sleep well at night. Look after your own needs, please, because looking after your own needs helps you to look after the needs of other people. You will find it very helpful as well to stay in touch with family and friends. And particularly now when we're in lockdown, it may not be possible to visit people, but please consider contacting people by calling or by using a number of video messaging services available. Engaging in physical activity can be very helpful. You may want to consider going for walks, going for jogs. You may also want to consider taking up some exercise such as yoga. As best as you can, try to maintain a routine. Having a routine can take the stress out of the day or at least reduce that stress. So try to see if you can have a routine for waking up at a certain time each day, going to bed at a certain time, and also incorporating breaks into your day. Please take up opportunities to discuss the experiences that you're having. Discuss them with members of your staff, so your fellow co-workers, talk to your family and friends. Expressing your emotions and thoughts can be very helpful for you at this time. And when you're talking to people, just ask them what they're doing to cope. We are all doing different things at the moment, and you may learn something new from someone. You may be able to take up a new strategy that you had not previously considered. Leaving work, it's important to switch the focus. We talked earlier about trying not to watch the news, for instance, when leaving work. If you do need to watch the news, just limit the amount of time that you spend doing that, but please try to reconnect with some things that might be useful to you. Listening to your favorite music can reduce stress as well as rereading your book, watching a show, or a movie that you enjoy. As best as you can, avoid relying on things like alcohol and high sugar foods to cope. Even though they may offer some benefit initially, the benefit will soon wear off, and unfortunately, excessive use of alcohol and high sugar foods will soon bring their own problems. If you're feeling overwhelmed, that is totally okay, but know that there are ways to get support. Most of you will find some of these strategies helpful, and you may be using a number of them yourself. For most of you then watching today's webinar, this will be enough for you to address any kind of problems that you're having. For some of you though, you may need more, and that is totally understandable. If you do need more, here are some signs that might let you know that you do need that. Please reach out for additional support if you're having feelings, thoughts, or bodily sensations that feel too intense for you to handle. Please reach out if you are finding it hard to express your thoughts or feelings, or that you find that you have no one to do that around with. If your home or work relationships are being affected, or if you're relying excessively on smoking, food, or alcohol. And definitely reach out if you're feeling emotionally and physically exhausted. When you reach out, there are a number of supports that might be available to help you. For most of you, the supports that might be helpful will be informal, such as talking to your manager or fellow co-workers, family or friends. But some of you might need more formal support. And so it might be useful for you to explore what might be available from local psychology services that are able to support staff at this very difficult time. You may also want to talk to your general practitioner, your local doctor, who may be able to offer some support. And remember that if you would like your support to be more anonymous, there may be a number of helplines and forums for you to access. On behalf of Julia, Isabel, and I want to thank you very much for joining us on today's webinar.